Okay, I'm going to do NG2 placement. The first thing that I am going to do is identify my patient orders. Once I identify my patient orders, I will verify my patient doctor's orders. I would identify my patient. Once I have identified everything for the right patient with the medical chart, I will gather my equipment, which is going to be my basin, my drape, it's going to be my tissue, tape, lubricant, and the actual NG tube. Once I have gathered all of those things, I will wash my hands, and then I will put on clean gloves. Once my clean gloves are placed and on, these are small gloves. Once they are placed, I will position my patient into high Fowler's position, which the patient is already in. I will kind of have the bedside table over the patient, having the basin ready just in case the patient needs it. I have tissue. We're going to pretend this is water, a cup of water if I need them to help with swallowing. The first thing that I'm going to do after assisting my patient to high Fowler's, as long as it's not contraindicated, and I've supplied, have everything positioned for the patient, I'm going to drape the patient with a disposable drape. I'm going to check nostril, try to figure out which nostril I'm going to use. So I will have the patient, I'm going to include one nostril and have the patient take a deep breath or breathe in and out on each side. And I'm going to say I'm going to use the one closest to me because the patient don't have any problems with breathing out of the nostrils. Now once I have done that and check my patency, I'm going to pretty much get my NG tubing, and then I'm going to measure. So the first thing that I will do for is measuring. I will measure it from the tip of the patient's nose to the tip of the patient earlobe, and then to the tip of the xiphoid process. Now once I have that placement confirmed, I will mark it with tape, which I already had here. And that shows where I need to stop. Now once I have that placement, I will get my water soluble lubricant, and I'm not going to have that dangling, but I'm getting my water soluble lubricant, and I'm going to lubricate this for up to 3 to 4 inches, and then I will start inserting the tubing. While inserting the tubing, I will have the patient, as I insert it down the tubing, I will, downward and backwards and kind of, maneuver it down, have the patient instruct the patient to put their head to their chin and swallow as I insert the tubing. Now, if the patient shows any signs of distress, for it's like coughing, gasping for air, cyanosis, any type of distress, of course, I will stop the whole procedure and discontinue remove the tubing. But since my patient is not having any problems with the tubing placement, I will continue on until I get to the point. And this, so once I get it in there, going to mark this spot on the patient nose. So I'm going to temporarily tape that spot. And then I need to confirm placement. So ways to confirm placement will be I can redraw gastric contents and check it against the pH, or I can get a chest x-ray depending on the doctor's orders. Once I have confirmed placement, I will actually secure the tubing permanently. Sometimes they'll have the little actual little thing that connects to the tubing where you can tape it to the client's nose, but since I don't have that, I'm going to use tape. Okay. So now that I have it actually secure, I know that it's in the right spot. I will either connect the tubing to suction. Once it's connected to suction, or depending on what the doctor's order, it can be connected to a feeding pump. I will go ahead and connect it. Once I'm done with that, and according to the doctor's orders, I will remove my gloves. I will wash my hands, and of course I will document. So I will document the size of the tubing, the size and the type of tubing I use. I will document which nair I use, description of any gastric contents that was seen during the placement, and then the patient tolerance.